Okay, good morning. Thank you. Good morning, all, and you are welcome to the Tesla e-conference. I'm Lawal Ismail, a medical doctor with Waterit Program Nigeria. I'm here to present on my project which I did on evaluation of the National Health Insurance Scheme awareness among patients who are accessing HIV services at a military health facility in Nigeria. We all know the problem with accessing or getting a research done in military facility in Nigeria, and this is one of the things I try to do to ensure we did this. So the basic thing we look at is to be able to look at, okay, what is the uptake, what is the awareness of HIV services or national health insurance among patients who are accessing HIV services at the military health facility Defense Headquarters Clinic in Abuja, Nigeria. We know that the National Health Insurance Scheme of Nigeria was signed into law in 1999, and this did not come into place until May 1999 when the bill was passed. And this leads to the establishment of the National Health Insurance Scheme, which is also an agency under the Federal Ministry of Health in Nigeria. The objective of this project was to review the awareness of the National Health Insurance Scheme among HIV positive clients accessing care in DHQ Medical Center in Abuja. The study was done as a cross-sectional study in which a primary data was collected. I tried to get a moderate. There's a Ministry of Defense Health and Research Ethics Committee, who is like an IRB that needs to approve after completing my CITI course. So I got an approval from them, and the questionnaire was developed, after which I was given permission to answer or to administer questionnaire to the client. So sample size was done, and we use a simple random sampling techniques to get the sample size of the client who we administer the questionnaire onto them. However, the result of the questionnaire and also the assessment shows that larger percentage of the clients who access HIV service in the facility are more of female, which is almost about 55.46% of the clients. And of these clients, also 59.29% of the clients attain tertiary health education. We know that the center where we use also, this is also fun because this is an urban area. Abuja is the federal capital of the country, and so you expect a lot of people attain tertiary education. Tertiary education was classified as any client who attain HND, that is we have OND, we have HND, but anybody that passes through HND are classified as tertiary education. Some of these people also undergo the national NYSC scheme. In terms of the educational level and employment status, larger percent of these patients also, of those who attain tertiary education, are also aware of NHIS. This is also in connection with their level of education. And the same thing, larger percent of these participants are also employed, because we know that in Abuja, is a seat of the government where a lot of people come in to look for God, job, and so on, and they're able to get jobs. So most of these people have a means of livelihood, with few of them not having a means of livelihood. However, awareness of the NHIS was very poor, was high among those employed and those that are not employed. However, how do these people get to know about NHIS? This is something we need to also look at. The participant, larger percentage, got to know about NHIS through friends. And we know that in this part of the world, rumors are as easily carried among people when they are discussing among their cohort and also among their groups, which is what we find in this study also. However, there's also contribution from the radio media and also from the television, where a lot of people also got to know about NHIS through this means of communication. The other area that is also very prominent, okay, even though they are aware of NHIS, are they confident that they can get better services from NHIS services? Larger percentage also say they are confident of NHIS, even though they don't have access to NHIS services. And of those that are confident, larger percentage of them are more of female, which is about 136% of the total, 136 in number of the total population of 366 that are sample size. So I was at the level of the confidence level of the participant, and I say a lot of participants, which is 136 of the participants, which is almost about 67% of the study population, are very confident of NHIS program in Nigeria. However, there are still people who are not confident of the services, and these are also because they fear when they go for NHIS services, they don't get quality care, or they don't get the good jobs or the best jobs they feel they should be given. And this is why some of them are not confident of the NHIS. However, looking at the conclusion, 41.6% of the respondents get to know about NHIS through friends and also speak to the statement that good or bad news travel faster in the country than maybe through radio or any other means. However, radio communication spread news faster, and a lot of people have access to radio communication in Nigeria. And this collaborate with Adewale Eta study in which electronic media such as radio and television were the most cited source of information in the country. However, 57.6 are confident that they will receive quality healthcare through NHIS when they need it. Hence, the constitution of the program needs to work hard and ensure that the primary providers of HMO live up to the standard. The HMO are the health maintenance organization who are the intermediary between the National Health Insurance Scheme and also the service, the client, to be able to get the service they needed. However, the study was conducted in a military facility among clients that are accessing HIV services, and in this facility, the patients don't have access to NHIS. Hence, participants indicate that they will be very glad to ensure that they include HIV services in the NHIS, because if you look at the donor now and also the country HIV program, which is looking at sustainability, a lot of the investigation are not being covered. So if this is introduced into the NHIS, this will help the participant to save a lot of costs, since they need some of this investigation only once in a year. And when they're able to do this, they will also improve the quality of care. So the conclusion from this study is that the NHIS awareness is good among clients who are achieving HIV services, and they are all aware, and a lot of participants are known. However, the participants express that they will want the NHIS to be included in the HIV care and treatment services to be included in the NHIS program, because if this is included, it will improve sustainability, and also it helps the Nigerian government to achieve the UN's 1990 goal by the year 2020. And this will also lead to the sustainability of the HIV program in country, because this will take care of a lot of things. However, I will also suggest that more study will need to be conducted in some other facilities around the country to also extrapolate and see larger view of the people pertaining to NHIS and HIV care and treatment services in the country.